Global crisis unfolds, South America overrun by reanimated dead, worldwide response intensifies. Breaking news, South American outbreak, the dead walk. September 15, 2024. 8 a.m. Breaking news alert. A chilling and unprecedented outbreak has swept across South America, with horrifying scenes emerging of deceased individuals reanimating and terrorizing towns. Witnesses describe these walking dead as relentless and aggressive, attacking anyone they encounter with chilling precision. Eyewitness accounts from Brazil, Argentina, Chile, and Paraguay paint a grim picture: streets littered with abandoned vehicles, barricaded homes, and the anguished cries of those desperately trying to survive. Local authorities are overwhelmed, with emergency services reporting that the situation is rapidly deteriorating. Survivors are sharing harrowing stories of their encounters, including instances where entire families have been slaughtered or forced to flee in the dead of night. The sheer scale of the violence and chaos has left entire towns in a state of panic and disbelief. 10 a.m. Emergency response mobilized. In response to this global emergency, the United States, the United Nations, and China have urgently deployed naval and air force units to South America. Their mission: to assess and contain the outbreak, and to provide support to the beleaguered local authorities. Medical teams from the World Health Organization and the Department of Disease Control have arrived, but their efforts are hampered by the sheer volume of cases and the hostile environment. Breaking news update. European countries have taken drastic measures, closing all borders and suspending flights to and from the UK. Russia has halted all international air travel, and Asian nations have recalled all off-duty military personnel to active duty. The United States has placed both the Army and National Guard on high alert, and the Mexican Army is reinforcing the southern border to prevent further spread. NATO has been activated at its highest level of alert since the Cold War, signaling a dire global response. 1 p.m. Global reactions and alerts. Disturbing reports of similar reanimation incidents have emerged in Australia, Russia, and the UK, with increasing numbers of affected individuals. This new wave of cases is amplifying fears of a global pandemic. Countries worldwide are issuing amber alerts, urging citizens to remain indoors, lock all doors and windows, and avoid any unnecessary contact with others. In cities across the globe, there are scenes of mass evacuations and chaos. People are abandoning their homes, leading to traffic jams that stretch for miles. Emergency services are struggling to navigate the gridlock, significantly delaying their ability to respond to the crisis effectively. 3 p.m. Scientific investigation underway. Scientists and health experts are racing to identify the source of this outbreak. Theories under consideration include airborne pathogens, transmission via wildlife, or a previously unknown virus. With each passing hour, the urgency of the situation intensifies. Laboratories are working around the clock, but the lack of conclusive results is exacerbating public fear. Breaking news update. The situation is worsening, with reports of the dead breaking through barricades and attacking medical teams attempting to provide aid. The growing violence is further straining already overwhelmed resources. The public is increasingly alarmed, with many questioning the effectiveness of current containment measures. 5 p.m. Continuing developments. As night falls, the severity of the outbreak is more evident. Cities are plunged into darkness as power outages occur due to overwhelmed infrastructure. The dead continue to roam unchecked, creating zones of terror where entire neighborhoods are cut off from help. Authorities are advising people to avoid making any unnecessary movements and to remain vigilant at all times. Announcement: International measures. The World Health Organization has issued an unprecedented global alert, urging all countries to implement strict quarantine protocols and bolster surveillance measures. Governments are scrambling to coordinate their responses and secure their borders. Public panic is growing, with widespread fear of an uncontrollable pandemic. 9 p.m. Final update for the day. As the crisis deepens, the global community remains on high alert. The outbreak spread is accelerating, with new cases reported in additional countries. Authorities and medical teams are working tirelessly to manage the escalating situation, but the overwhelming scale of the crisis leaves many questions unanswered. Breaking updates. 10 p.m., reports confirm that multiple major cities in South America are now under martial law due to escalating violence and panic. Emergency shelters are overwhelmed and supplies are running critically low. 11 p.m., the United Nations has called for an emergency summit to address the outbreak, with leaders from affected nations and global health experts convening to develop a coordinated response. 12 a.m., the first confirmed cases of the outbreak in Canada and South Africa have been reported, raising concerns about the rapid spread across continents. 1 a.m., power and communication outages are being reported in several countries, complicating rescue efforts and leaving many in the dark about the ongoing crisis. 2 a.m., the WHO has announced the establishment of a global task force to investigate the outbreak's origins and develop a vaccine. The task force will be working with international laboratories and experts in a race against time. Stay tuned for further updates as the situation continues to evolve. The world watches with bated breath as efforts to control this nightmarish outbreak intensify. If you enjoyed this short story, don't forget to like and subscribe before the zombies start biting.